Hello everyone. Today we are doing a presentation about interprofessional collaborations. In my group we have Bailey, Bonnie, Olapami, and myself Sam. So the presentation defines interprofessional collaborations, explain how to manifest it in workplace, describe potential ethical issues arise during the interprofessional collaboration, and also how to resolve them. According to the World Health Organization, interprofessional collaboration defines as various healthcare professionals from different backgrounds work together with patients, families, and communities to provide the safest and best quality of care across settings. The benefit of collaboration allow healthcare professionals to achieve together more than they can individually, serve larger groups of people, and grow on individual and organizational levels. Complex medical issues can be best addressed by interprofessional teams. Interprofessional collaborative practice, which include communication and decision making, enabling a synergistic influence of grouped knowledge and skills. Elements of collaborative practice include responsibility, accountability, coordination, communication, cooperation, assertiveness, autonomy, and mutual trust and respect. It is this partnership that creates an interprofessional team designed to work on common goals to improve patient outcomes. Collaborative interaction exhibit a blending of professional cultures and are achieved through sharing skills and knowledge to improve the quality of patient care. There are important characteristics that determine team effectiveness, including members seeing their role as important to the team, open communication, the existence of autonomy, and equality of resources. It is also important to note that poor interprofessional collaboration can have a negative impact on the quality of patient care. Thus, skill in working as an interprofessional team gained through interprofessional education are important for high quality care. For example, in a hospital setting, we have doctors, nurses, pharmacists, respiratory therapists, physical therapists, and occupational therapists who work together to make sure patients receive appropriate medications, services, and treatment to make the patient feel better and recover faster. There are two factors that make interprofessional collaboration successful. Number one is communication, and number two is the use of skills and knowledge of all healthcare professionals to the optimal level. Communication is a key factor in interprofessional collaboration because each professional needs to communicate to the team the plan of care from his or her perspective of discipline. For example, when a physician is prescribing an antibiotic, a pharmacist can recommend the most effective and least harmful antibiotic that is specific for the patient and the growing organism. Therefore, the patient is receiving the best treatment. The optimal use of skills and knowledge of all healthcare professionals ensure that the patients are receiving the highest quality of care. For example, speech therapists can work with patients and teach them about safe swallowing techniques, aspiration precaution, and correct any speech impairment. The primary goal of interprofessional collaboration is to improve the quality of healthcare delivery.
This slide is going to be how healthcare professionals ensure ethical interprofessional collaboration in practice as an everyday practice actuality. So one of these things is going to be problem-based learning, focusing on learning approaches and gaining confidence in how to work interprofessionally through a test situation. So some of these cases are going to be mock scenarios that are similar to a actual patient scenario where the healthcare team is required to work together, collaborate, and come up with a plan. This is a test situation that allows for assessing room for improvement and addressing things that went well, and be able to incorporate that into their everyday practice. Next is valuing and respecting other professions within the healthcare team and the unique scope of practice they provide to the patient. So the patient care team involves the provider, the nurses, the medical assistants, the CNAs, potentially occupational therapy, physical therapy, speech therapy, lab, diagnostic imaging, and in some cases respiratory therapy, code team, IV team. So there's several people that are incorporated in the patient care. So this allows us to all present our strong suits to the patient. So respiratory therapy does a lot of the breathing treatments and a lot of the vent settings. The providers do a lot of the ordering and managing the patient, and the nurses do a lot of carrying out these orders. So it's important that all of these team members value each other's individualized approaches and skill sets to be able to provide quality care for the patient, and appreciating the patient's personal preferences surrounding their own care. So the patient may have different spiritual, professional, religious, cultural preferences that they want to be appreciated in their plan of care. For example, Jehovah's Witnesses do not want blood products, so it is our job as our healthcare team to appreciate the patient's thought process and their personal choices and be able to provide patient-centered care. And also, we need to value the importance of treating the whole patient rather than the diagnosis. So this means treating the patient mentally, physically, and emotionally, and being open to the patient's values and making sure that we work together as a team to provide patient-centered care as a whole rather than just treating a diagnosis.
This slide talks about some of the ethical issues that may arise during interprofessional collaboration. One of the issues is lack of mutual respect and trust between professionals, and this was found in Interprofessional Education Collaborative Expert Panel for 2011. Mutual respect and trust are important for an effective collaboration to happen. It is important for each healthcare professional to honor the diversity and expertise that may be present in the team. There is a need to remember that each member of the team or each collaborator is a professional, and they possess the expertise that may be lacking in the other. It is difficult for professionals to trust a person that they do not respect, and accurate information may also be missed if a recipient does not respect the source, and this may in turn affect the patient care outcome. Also, one of the issues found was poor communication between healthcare providers, and poor communication between healthcare providers has been found to be a major contributing factors to the errors made by healthcare professionals. This has resulted in threats to patient safety. Professional influences such as difference in perspective regarding patient outcomes, power struggle among team members, lack of role clarity, lack of understanding about roles and scopes of practice of other providers, as well as stereotyping with regards to the other professions. These all have been found to contribute to the poor communication found in healthcare. And this has been found also to reduce the contribution from some of the healthcare providers that might be vital to the patients, such as social workers, nurses, occupational therapists, and this may lead to limited participation of some groups in planning for the care of the patient or planning with the patient. Also, the patient's safety might be in jeopardy, and this goes against the principle of doing no harm. And concerns about patient safety and the impact of limited or tense communication among healthcare professionals has led groups such as the Committee on Quality Healthcare in the United States to recommend cooperation, collaboration, and teamwork among clinicians in order to ensure patient safety. So it's important to focus on the safety of the patient when collaborating. Also, all of the above mentioned factors could contribute to a toxic work environment, and issues such as different perspectives about patient outcomes, power struggles among the team members, lack of role clarity, lack of understanding about roles and scope of practices of providers, as well as stereotyping can lead to low morale, which in turn will create a toxic work environment.
Resolving Ethical Issues with Interprofessional Collaboration by Bonnie Moon. Ethical decision-making is an important process for making difficult choices in an interprofessional collaborative team, especially since personal values and ethics might differ from person to person. An ethical dilemma is more likely. There are steps to follow when an interprofessional team needs to agree on the best course of action when there is no exact right or wrong answer. The first step is to gather the facts. As a team, do a thorough investigation and avoid jumping to conclusions before all the facts have been gathered. Ethical issues are difficult to solve, and gathering all the facts can be challenging. Do the best you can with what facts are available. Gather the facts on who, what, when, where, how, and why. Make sure all the facts are not assumptions, that they are actually facts. Next step is to define the ethical issues. Before you come up with solutions, make sure you can define the ethical basis for the dilemma you want to solve. If your team has multiple ethical dilemmas, solve only one at a time. Next step is to identify the stakeholders. Who are the affected parties? Who are the primary stakeholders that are directly affected by the ethical issue? Who are the secondary stakeholders that are indirectly affected by the ethical issue? Why are these people the stakeholders of the issue? What do you think the perspectives of the issue for the stakeholders are involved? As a group, identify all of the consequences that will result from the dilemma to the affected stakeholders. Identify both the negative and the positive consequences. What is the extent to which the consequences will give? What are the possibilities to those consequences that will happen? What are the short and long-term consequences, and how will they happen? To make it simple, focus on the primary stakeholders. Make a decision using only the consequences and see if it is the same solution at the end of the process. As a team, identify the obligations of principles, rights, and justice. What ethical principles are we obligated to follow? Is it benevolent? Is there harm? Are you following the golden rule? What are the obligations to ethical rights of stakeholders? What are the simple rights and what are the secondary rights? Are we protecting autonomy? What are the positive and negative rights? Are there issues with justice or fairness? Are there cognitive issues or biases? Come up with a solution based solely on obligations. As a team, consider your personal character and integrity. What would your group decision say about your own character? Does it reflect a person of integrity? What personal truths or virtues are relevant? What if your decision was made public? Would you still be okay with it? How will this decision be remembered? Are there biases and barriers to your decision? Then decide what is the best decision based solely on your character and integrity. As a team, consider all potential actions, including what you may have not considered. For instance, if you have two solutions, is there a third solution? Be creative in this process. What solution that involves the primary stakeholders have you not considered? Check your gut. Even though you have completed all the steps in this process, it is still good to do a gut check to see how you feel deep down about the decision. Our intuition gives us credibility for our decisions and can show us if something is not okay to do. Consider the intuition of the members in your team that have more experience in the field that most involves the ethical dilemma. And lastly, consequences. As a team, decide on the proper ethical action from consequences, obligation, and character-related solutions. What will you do to deal with the consequences of the action? How do you protect your rights and your stakeholders' rights? How do you avoid compromising your own character while maximizing benevolence for the involved parties? The final step involves knowing how to respond as a team to those with opposing viewpoints.